Welcome to the show, Congressman Sestak.
Great to be here. Thanks, Steve, again.
You're welcome. What can you tell us? The highs, the lows, what did you agree with, what did you disagree with, and where do we go from here?
Well, I think the lows was in the build-up to this over the past 6 months, where I felt that Washington, D.C. was in an echo chamber and needed to be out on the hustings a lot better and to explain why this bill was necessary and how, if the individuals had private health care today, they needed to be for this bill so they could afford it tomorrow. The high was, without a question, the day we passed it. I was able to go and speak about an hour prior to its passage on the House floor. And I spoke that I had come to Congress after 31 years in the military to pay back a personal debt that I owed this nation. Because after those 31 years in the military, my daughter was struck with a malignant brain tumor, and given just 4 to 9 months to live, this nation provided us in the military health care for everyone. I got into Congress to pay back that everyone should have that type of accessibility to affordable health care. In the military, we do it because of the dividends that reap for our nation. Healthy, focused warriors. Well, it's the same way here at home. Everyone should have it because we want focused, productive workers who are healthy. And so that was the high. And in between, now we have to see what kind of leadership we have on the Senate in order to bring this into the end zone, getting it all the way to where every Pennsylvanian will have a health reform so that our premiums don't double the next 8 years like they did the past 8. That the equivalent of Allentown 1 week, Reading the next week, are losing their health care as 14,000 Americans are losing their health care every day. That's why this is an absolute necessity for our economic health securities.
A big split seems to be developing within the Democratic Party with regard to this abortion amendment that's been attached to the bill. How did you shake out on this amendment, Congressman?
I voted against the amendment because I think it affected the status quo. The status quo is no federal funding will be used for abortions. And so what our bill originally said was, look, if people sign up for a private health care plan that offers abortion, that they're subsidized by the government because we're going to cover those who cannot afford it today, that their premiums that they pay as their share of the health care bill, even if it's in the public option, only their private premiums can pay for an abortion if they elect to have that. It's to be segregated, these premiums, and only the private, out-of-pocket expense monies can pay for it. What this bill did, this amendment, the Stupak amendment, is it took a step further. It denied you the opportunity to do that if you joined the public option. Even though when you join the public option, you have to do your copays and premiums. Even if you're subsidized, you got to pay part of it. And number two, the language was very concerning that today in a state is permitted to put up their own dollar, not even a matching dollar to a federal Medicaid dollar, but a third dollar of their own in order for people to have a choice. I felt it disturbed the status quo that had been out there since the Hyde Amendment was in effect, and that it was a fair decision where privacy was permitted for individuals to have the right to choose with their own private money, and I think it went too far. That's why I voted against it.
A Colorado Representative Deanna DeJet, said that she's collected more than 40 signatures from House Democrats vowing to oppose any final bill that includes the amendment, which would be enough to block passage. Have you signed her petition yet?
I have not. And the reason is I want to see what the final bill is, because I also am very taken that we have 40 million Americans that don't have health coverage. And I have to weigh that decision to cover them, as well as to recoup the $260 billion a year we lose in economic productivity because of the under and uninsured, vis-a-vis what she is passing around. This is a weighty decision. And I think and I've already talked with her, that somehow in conference between the Senate and the House bill, there will be effected a fairer compromise. And that's what I'm waiting to see before I sign up. Because my daughter had a brain tumor. I'll never forget the young 2.5-year-old boy. As my daughter, after brain surgery, began her chemotherapy. And she had a roommate. And this 2.5-year-old boy his parents didn't have health insurance, and he had been diagnosed with acute leukemia. And I always will keep him in mind of how do we ensure everyone is covered, and not just for themselves, but for the economic necessity of having a healthy, productive worker in the future. So I've got to weigh that in this decision.
Yeah, because DeJette predicted, to use her word, a firestorm. She said that women are going to realize that a Democratic-controlled House has passed legislation that would prohibit women paying for abortions with their own funds. So it's a real issue.
Yeah, it does, because it does not permit them to use the premiums they're signing up out of their own pocket into a private or a public option. They can still use because that's to join up to the plan. If they want to be covered and they're subsidized by the government in the sense that they're 400% or below in poverty level, then they'd have to pay an extra premium to get a rider on there to have a choice out there. That's why I said it went too far. And, they could still have access to it, but it makes them take that extra dollar out of the pocket. And so my issue is remain with the status quo. I've talked to her and others, and I think you're going to see us go back to the status quo in conference of the Senate. But I have to tell you, I do believe that this health care reform bill is an absolute necessity. It's why I got into Congress, but I also did it because 2 companies in Pennsylvania have 70% of all the private health care plans, and they dictate the prices. They're like a monopoly. And until we get the public option out there that doesn't pay millions in CEOs' salaries or severance pays or high advertising costs and high profits, as one company of those 2 that I mentioned have $3.5 billion in reserves that they keep in reserve. All of a sudden, you have dictated prices rather than a fair competitive market. So we need to do this reform overall, and that's how I have to weigh it overall.
Yeah, and with regard to the public option, the Senate version would limit the public option. It would allow states to opt out of it. Are you monitoring Senator Specter's positions on these matters?
Well, it's kind of hard to monitor because, as he often says, everything's on the table. No, I want to know, Senator, what's your position? Look, I'm not asking people to agree with my position or not. I'm asking them to understand that I've studied it, I've listened, and hear how I came to it, but I'm standing for principled, accountable leadership so they know where their representative is. I don't know where Arlen is today. So I know he's for a public option, but what type? And so we have to see. The opt-out option is not a good option. Here's why. We already know here in Pennsylvania, as I mentioned, we've had in the last 8 years health premiums raise 100%. 700 people are losing their health care plans every day in Pennsylvania because they're going out, they can't afford them. And besides that, the bankruptcy of our people, 1 out of every 3 or so bankruptcy cases are caused by high medical costs. We've got to have the public option to get fair, competitive pricing again in the marketplace. That's why we need it. Why do we have to wait another 4, 5, 6, 8 years to find out? Millions more have lost their health care plans like they did since 1995 when Senator Arlen Specter opposed the Clinton health care reform bill, which would have covered everyone and, according to the Congressional Budget Office, reduced premiums and even reduced our national debt. He opposed it, and 10 million Americans since then have lost their health insurance. No, we need a new way, not just in a comprehensive health care plan to cover everyone, but a new type of senatorial leadership where you stand on principle and fight. Not just wait for the final deal, but you fight for what's good for Pennsylvanians, and you stand tall and you say, here's what I believe in, and you work hard for it from day one.
So the position that you're sensing from Arlen Specter is clearly not the position that his actions showed during the Clinton administration when they fought for health care.
No, you're absolutely right. Senator Clinton hangs in his office, or did until I got into the race, a trophy. It's a large poster board that he and Senator Bob Dole, both Republicans, as Arlen has been for 45 years, that they took around America that misled all Americans on what the Clinton health care plan would have done. After he hung it on his wall as a trophy, unfortunately, 10 million Americans lost their health care plan. Now, look, I respect Arlen, and I think we should thank him for his service. But it's time to move forward to somebody who really does stand for Pennsylvanians. Look, take our state. We're the third oldest state in the nation. Why? The youth aren't staying. We have lost our manufacturing prowess, much of it. We're still tremendous. We're absolutely great Pennsylvanians. The issue here is, though, that we have had, since 2001, 2007, 50% of the working families in America are earning less in real income, even before this Great Recession. And although I want to thank Arlen for the last 30 years as a senator, the next 30 years just take a different approach. We're in it for the health, the education, and the economic security of our people. Thank him for his service. But we need a new type of accountable leadership, not one that derails plans, but one that builds the railroads for us to have better plans for our people in the future.
We'll continue to follow this as it develops, Congressman Sestak, and thanks so much for sharing your part in this historic occasion, and we'll talk with you again as it progresses, and we always appreciate your willingness to talk with us in northeastern Pennsylvania.
Steve, thank you. It's always an honor. Take care, and everybody have a wonderful evening.